Greetings to all of our AACP members, as well as friends, visitors. Today we have the pleasure and honor of hosting Amber Lovatos and Dr. Carlos Vice. So the format for today will begin with an introduction from Dr. Vice, followed by a feature presentation by Amber Lovatos, and ultimately concluded with a Q&A session. And next, I'd like to introduce Dr. Vice, co-chair of the Education Committee for AACP. He has been an amazing asset to not only AACP, but other organizations that we collaborate with. He has his own practice in the Dallas-Fort Worth area, and we're honored to have him here today. So Dr. Vice.
Thank you, Jordan. I appreciate it. I'd like to welcome our audience of AACP members and any guests we may have for this event. Today's webinar is a collaborative presentation with our colleagues of the American Academy of Orofacial Pain, the AAOP. We're so glad you guys can join us today. We're very happy to share this with you guys. I hope everyone and their loved ones are doing well in these unprecedented, difficult times. I personally feel very lucky to be in such a privileged position with all my loved ones safe and secure, obeying social distancing here at home. But at the same time, I'm keeping in mind all the people in the world that do not have that option. I pray especially for our first responders that have become our new heroes. They deserve our support. All our financial worries that we currently have, along with millions of business owners throughout the world, I do have faith that they will be overcome, and soon we will be in our offices taking care of our patients and staff with a renewed sense of purpose. This nation and the world historically have always come back stronger from adversity such as this one, and this pandemic, I'm sure, will be no exception. Today, I'm very glad and very excited about this webinar. Recently, there has been a great deal of talk regarding teledentistry, which, as many of you all know, in our case, it really needs to be called telemedicine, since our practices fit more the medical model than instead of the dental model. Today, I'm glad to introduce a fellow transplanted Texan. Here in Texas, we have a saying, I wasn't born in Texas, but I got here as soon as I could. And I guess that's a saying that reflects how proud people in Texas are of their state. Mrs. Amber Lovatos, I'm very proud to present her. She's a speaker today. She's an RDH, and so she has a very good understanding of dentistry. Amber is the clinical director of dental services at TOMAGWA HealthCare Ministries. She's also an adjunct assistant professor at the University of Texas School of Dentistry in Houston. And she's a government affairs consultant for MouthWatch, LLC. Her research has focused on all aspects of teledentistry, including attitudes and knowledge towards teledentistry, teledentistry applications, teledentistry legislation, and teledentistry in dental curriculum. She has presented numerous times, both nationally and locally, on the application of teledentistry and teledentistry legislation. Amber, you have the podium.
Well, thank you. Thank you for having me. So first, I wanted to mention that I am a consultant for MouthWatch. As a disclosure, they're the ones sponsoring this CE. So I do mention their product, but know that my presentation is not influenced by them or the product. This information is my own. So we'll start out with defining what teledentistry is. I think this is a big misconception. People seem to think that teledentistry is just public health, or that teledentistry is just exams. Teledentistry is all telecommunication. And telecommunication is like emailing, Zoom conferencing, go-to meetings, what we're doing right now. This is all communicating through technology, things that we do daily. So teledentistry isn't new. This is something that we've all been doing in our practice. And so telecommunication and healthcare is, telehealth, telemedicine. And then depending on your state, the definition varies. So some states, telehealth is just telepsychology. But in other states, telehealth will be everything but medical and will include dentists as eligible providers. So some states don't define telehealth or telemedicine or teledentistry at all. The best scenario, I think, is when it's telehealth, and then or telemedicine, and then lists dentists as eligible providers. And I say this because usually when there are waivers happening, they'll include telemedicine, they'll include telehealth, but they don't ever really think about dentistry. They don't say, we're going to waive HIPAA requirements for dentists. No, they do broad terms. And so we'll go into that a little bit more. So teledentistry is the use of telecommunication or communicating through technology to exchange patient clinical information for dental consultations. And many of you have done this, you know, if you've ever had a referral from somebody and they sent you a panel, that's teledentistry. And then treatment planning and diagnosing. This is more the exam portion of teledentistry and what people usually think of teledentistry when you mention it. There are two types of teledentistry. There's synchronous, which is real-time, two-way encounters. This is what you would think of FaceTiming. You can see the patient, they can see you, you can communicate with them, you can ask them questions, ask them to do different movements. This is, I think, the better option because if you do asynchronous or store and forward, that would be collecting the information, sending it to the dentist, then the dentist treatment plans and diagnosis at a different time. Prior to COVID-19, this was usually, you would have an allied healthcare provider collecting the information for you and then sending it to you. Well, now, you know, most of us aren't really seeing patients anymore. So synchronous is really the most common, but it also depends on your state. If your state has guidelines, some states say you can only do synchronous. Other states say you can only do synchronous, except dentists, they can do asynchronous. We'll watch this video just to give you an idea of what asynchronous or what synchronous dentistry is. And this doesn't really, it's not applicable to you, but just to give you an idea.
My name is Melissa Green. I'm from Red Creek. This is Jason Green. He's 6 years old.
Was it pretty cool what you picked out there, Mr. Jason?
Yeah, I have a whole monster bag with a whole turbo.
There's a little the mesial decay on G.
Yeah.
You're doing excellent, buddy. Thank you so much. Hoping really good. We're almost done already because you were so good at this. It looks like it has a
Resin on the help.
yeah, it looks like it has a resin. Yep.
That was really cool, getting a close-up shot of all of his, I like to call them teeth bugs, and issues that are in there, and the dentist in Rochester was seeing it at the same time. And since that was pretty much an online consultation, we can go right to Rochester and get the work done. You don't have to go there, have a consult, leave again, and then come back for the work.
So Pat will help set up everything to get their mom, okay, to help with the appointment.
Okay, so this is a synchronous interaction with the patient. Go back to my current slide. And so you can see they have the hygienist or the allied healthcare provider collecting this information using intraoral camera. They would have radiographs already. For us right now, that doesn't really work, right? Your patient doesn't have an intraoral camera at home. But your patients, there are softwares available where your patient can upload images of their own teeth. There are guidelines that you can provide your patient to show them how to take those images, and then you can communicate with them at the same time. So I'm going to give some examples of applications to teledentistry. You know, this doesn't really apply to you all, but it might give you an idea, because this is so new, teledentistry and orofacial pain, it'll give you maybe ideas for you to be creative, come up with ways to use it in your practice. So in general dentistry, it's obviously used for referrals to specialties. It's been used for exams so that dentists have hygienists offsite providing care. So cleaning, sealants, SDF, fluoride. In ortho, it's being used for consultations, for minor emergencies. A patient is in a remote location, away from their orthodontist, and they have pain. They can send in an image, and then the dentist can tell them the next steps. In pedo, it's being used to assess caries. So I think the important thing to note is that you don't have to diagnose everything. You just have to be able to identify that there's a problem. There's a problem, and we need to see them in person, and this is the next step. In pathology, it's being used very commonly to screen for lesions. And a lot of studies state that false negatives decrease with higher camera resolution. Well, I mean, that's obvious, right? If your patient has a low resolution camera or a really old phone, then their image isn't going to be as great, and it's going to be harder for you to diagnose and treatment plan or do the consultation, versus if they have a newer phone with great resolution, you'll be able to see things clear. So those are things to kind of consider when thinking about doing teledentistry. There's also being done for interprofessional consultations and referrals. So referrals in emergency rooms. We know a patient goes to the emergency room and needs care, they're likely just going to prescribe them something. So what emergency rooms are doing is they're collaborating with dentists and getting them referrals to be sent to get treatment. It's being used in pediatric clinics. So pediatricians now are looking at the mouth, applying fluoride. So now they're putting intraoral cameras in pediatrician offices. So if they see something, they can take an image and refer it to a dentist. So for oral and facial pain, Dr. Weiss and I kind of talked about it a little bit because to give you an idea more of your specialty. And then I started doing some research on, are there other dentists already doing this? So there's a company called Teledentists, and they basically are a for-profit company that any patient can connect to. You can Google them, but they do consultations for oral and facial pain and TMD. If the patient has radiographs, they can choose to connect with a dentist somewhere in the United States, and they charge them a fee, and the patient pays for that second consultation. It can be used for post-op exams, for screening sleep patients, for referrals to ENTs or physicians to collect that information and then refer patients. I think the important thing would be to note is if your care that you're providing, are you using codes that are dentistry codes, or are you using codes that are medical codes? If you're using medical codes, then you're doing more telemedicine, telehealth. It might be less restrictive because there are more guidelines for that. But if you're doing things that are like a limited exam, then you might be more restrictive depending on the state that you live in. For myofunctional therapy, that's not dentistry, right? You can be a dentist or a hygienist and be an oral myofunctional therapist, but that's not restrictive to that. And so they do telemedicine. There's actually a company that does telemedicine in Wisconsin, and they do TMG consultations virtually. They do tongue-tie tests. They provide therapy virtually. So now we're going to kind of legislation in a nutshell. So before COVID-19, you're probably one of these 4 examples. So either you lived in a state that did not have teledentistry policy, or legislation, which just means that you didn't have guidelines to how you could provide care. And if you were in a state, then you did have guidelines, and that also means that insurance companies would have to reimburse you at the same rate that they reimburse an in-person visit, which is really important to note. So they are required to reimburse you and then reimburse you at the same rate. That's what legislation would mean. Then you could live in a state that has limiting language. So you live in a state that has legislation, which means that you can be reimbursed, but in their laws, it has something limiting, like you can only use teledentistry in clinics. So then you're only restricted to clinics, and a patient can't do it from home, but you could still participate in teledentistry. Or you lived in a state that didn't have legislation, which meant that insurance companies are not required to reimburse you. And then there's no limiting language. So then you can still participate in teledentistry. It just meant that you might not get reimbursed and there is no guidelines. That is a little different now because now a lot of the insurance companies, and I'll talk a little bit more about insurance companies, but now a lot of the insurance companies are saying, we'll reimburse you for teledentistry services. even if your state doesn't have legislation requiring us to pay for it, we'll reimburse you. It is important to note, though, that even if your insurance company says we'll pay for it, it doesn't mean that your state allows it. They don't govern that. So even though companies are saying, yes, we'll pay for it, you still need to be careful and know what your state guidelines are. Example 4 is if you live in a state with no legislation, which meant possibly no reimbursement, but then you do have limiting language, like my great state of Texas, where we cannot do exams using teledentistry. So this just means that you couldn't use teledentistry for exams, but you could still use it for a consultation or referrals or triaging or screening. You could still use it for that, but you couldn't treatment plan and diagnose. An important thing to note about teledentistry is teledentistry doesn't change anybody's scope of practice. So if you're in a state where your allied healthcare providers, your assistants, your hygienists work under direct supervision, teledentistry doesn't change that. So if your state has those restrictions, then you couldn't use teledentistry with your hygienist or assistant offsite and you in a different location. You'd have to be with them. Teledentistry doesn't change that. Teledentistry doesn't change scope of practice. It's just a different way of doing the care that you're already allowed to do. So it's just the modality of it. So insurance companies. So I'm going to refer you to the ADA website. If you go to success.ada.org, they have a whole list of insurance companies that have said that they are going to reimburse during this time. So Aetna, Cigna, Blue Shield, Concordia has said that they are going to reimburse, and they list exactly what they have heard back from those companies. It's also important to note that every state is different. So this might be the federal Aetna saying, yes, we will pay, but you still have to look at your individual policy and your individual state. So it's important to inquire with those insurers to make sure exactly what they cover. They like to give these broad statements, but sometimes there are exclusions. So for billing, right now, especially during COVID-19, they've also listed what codes they'll reimburse for, typically limited codes. Before, you might have been able to get reimbursed for a comprehensive code, but then you would need radiographs. You would need your state to allow you to do teledentistry exams, and you can't do a comprehensive exam without radiographs. So during COVID-19, insurance companies have said that you can bill for a limited exam, so a D0140. So problem focused, they have a pain or just concern, you could bill for that. A reeval code or a post-operative visit code, and this might be one of the ones that y'all use mostly if you've delivered an appliance, you've done some sort of treatment. So now you can use this code to get reimbursed for that post-op visit. There are also 2 teledentistry codes, the synchronous code, so if you're doing a 2-way interaction, so the D9995, and then D9996, which is asynchronous code. These codes are not typically reimbursable. They don't really come with a fee. They're just a way of telling the insurance company the way that you provide care, so the modality. So if you did a post-operative office visit and you did it synchronously, you'd bill D0171 and D9995, but you'd only get paid for the D0171. Some insurance companies will pay for it, but it's very rare, and it's usually like an insignificant amount, like a few dollars. So the DEA also brought a waiver forth after the public health emergency declaration. So prior to COVID-19, you had to have an exam, an in-person exam with the patient to prescribe them controlled substances. And with this waiver, they're saying that during this time, you don't have to. You can start with a telemedicine encounter, but you have to have a legitimate medical purpose, obviously. It has to be, you have to communicate through audio visual and real-time 2-way interaction. So this is a synchronous call. You need to be able to communicate with them both ways. And then they state that you have to act in accordance with your federal and state law. This is something that people really fail to acknowledge. They see these federal waivers, but then they forget that you also have state laws and state requirements. If your state hasn't passed any waivers for prescribing and they are more restrictive, you still have to follow your state laws. So it's really important to be informed and know that these waivers aren't all encompassing. So legal issues. So it used to be thought that telehealth or teledentists were more liable or more likely to be liable or have higher legal risks for doing teledentistry or telemedicine. But that's not the case. Telemedicine research shows that you are not at higher legal risk as long as you're doing things properly. If you're documenting properly, documentation is really important, that you're making sure things are HIPAA compliant, making sure that patient information, PHI, is secure. And if you're doing those things, then you're not at higher legal risk. So another thing is malpractice insurance. So as a general rule, I've contacted malpractice insurances, and I know other teledentistry speakers who have done the same. And typically the response that we get back is that they will cover you for anything that is normal and customary within the regulations of your state licensing board. So here in Texas, if we were to do an exam using teledentistry, that would not be covered because that is not in line with our state licensing board. But anything else they would cover. So we'll talk about other considerations, safeguards, limiting language. So limiting language, and I'll mention Texas just because it's easy, but your state might not have teledentistry legislation or regulations, or they might, but you have to be aware of what the limiting language is. In Texas, we state that our exams are of a tactile and visual examination. Well, teledentistry is not tactile. So you can't, even though there are no specific laws that state we cannot do teledentistry, it does state that it has to be tactile and teledentistry isn't. But your state might say that a dentist can only collaborate with, 2 allied healthcare providers, 2 hygienists for teledentistry. It might be restrictive on where you can do things. And so I used to say that, you can do teledentistry anywhere. And typically you could, it just depends on your state. It means being done in hospitals, schools, prisons, shelters, places of work. But some states are restrictive and some states aren't. Some states say you can do it even in people's homes. HIPAA is a huge consideration. And we'll talk about the HIPAA waiver that happened a few weeks ago. But making sure the patient information is secure, the patient information is encrypted and password protected, and that we're safeguarding patient information is really important. And we'll talk about software a little bit more. Dr. Rice was telling me that you've all had a lot of teledentistry companies kind of trying to contact you and tell you, like, join our company, we provide software. I would really be careful and try to only go with a company that's reputable. There aren't that many teledentistry companies. There are a lot of telemedicine, telehealth companies, but they're not always user-friendly when it comes to doing dentistry or using dentistry and then incorporating EHR in them. So the Health Insurance Portability Accountability Act, the HHS Office of Civil Rights recently said that they would waive penalties for HIPAA violations. This is a little controversial because they state that, but then they also state that it does not overwrite your state HIPAA regulations. So if your state also has regulations and they haven't waived them, then you still have to follow those guidelines. Even if the HHS office federally said you can use FaceTime, you can, but also if your state says you can't, then you can't. And again, like some of these waivers, even if your state said, okay, we're going to waive telehealth providers from HIPAA violations, but dentists aren't listed as providers in telehealth, then that does not include you. Another thing to note is that even though HHS office is waiving penalties, you can still be reported to your state dental board for HIPAA violations. You could still be reported to the office of the HHS office. And you could still have legal issues come up for violating state laws if you're not following your state laws. So I think it's always important to be careful when saying, like, oh, I'm just going to use FaceTime, or, there are no regulations anymore, because HHS also says that you have to act in accordance with the patient safety, and that if you can use safeguards, that you should use them when available. And they do list some restrictions, like they say you can't use TikTok, but that's obvious, right? We're not going to use social media to put our patient's information out there. And they are being a little bit more lenient, but you also have to consider your state laws. And I think that, especially on social media, people are just putting out there, oh, we can do anything now. That's not the case. You have to be really careful and really know your state. And also, personally, I would always err on the side of caution. If I can be careful, I would be careful. I would use software that is encrypted to protect my patient's information. So licensing, very common question. There's not a special license to do teledentistry. Licensing is your same license that you have for your state. Now, let's say you're in New Mexico and your patient is in California, and this is your first interaction with them. You need to have a New Mexico license and a California license. And this is because if something were to happen and they came back and said, oh, well, they went to the state board and said, okay, well, this New Mexico dentist provided care to my patient and the patient was in California, well, the New Mexico licensing board could say, well, the care wasn't provided here. And if they went to California, then they could say, well, that dentist isn't licensed here. So typically, and the norm is that you need to be licensed. And a lot of practice acts will specifically state, and teledentistry and telemedicine legislation specifically state that you need to be licensed in their state to provide care. Now, if it's a patient of record, it's a patient that you saw in your state and they just happen to go to a different state, you could, typically they say that is okay, that you can still see your patient, they just happen to be in a different location. But your initial exam or interaction should be in a state that you're licensed in.
So Amber, you're saying that we could, if we have already a patient of record, because we see him sometimes for follow-up visits, we could, let's say somebody comes from out of state to see us, which happens to a lot of us, they'll be able to just do follow-up appointments without us having a license in their state, correct?
Yes. Mm-hmm.
Okay, thank you very much.
And that's something that Dr. Goldman, who is a big teledentistry guru, I've discussed with, and they've said that is okay. But if it's more than just a post-op, then I would say be licensed in that state.
Thank you.
And those states, and right now though, there are some states that are waiving licensing and basically saying, like, if you're not licensed in our state, that is okay. But again, it's mostly for telehealth and telemedicine. And so we're likely excluded from that. So we'll talk about MouthWatch, the company that is sponsoring our event today. So some good things about them is that if you're interested in teledentistry, they're offering 30 free days for their software so that you can use it, try it out, especially during this time of COVID-19 that you don't know. Maybe you'll use it right now, maybe after this you won't use it, so you could try it and they're not going to charge you for it. But they have online, offline modes. So if you're in an area that doesn't have like really good internet connection, you can upload information later. You can record your interactions and save them and then refer them to another specialist. You can, what's good about MouthWatch is it has provider to provider interaction. So if I wanted to connect with a specialist, I could connect with a specialist. But also if you wanted to connect directly to a patient, you can connect directly to a patient. What you do is you create an account for them, they get an email, they log in, they can upload images, and then you can do a FaceTime interaction with them. You can record it, you can turn off your camera, turn on their camera. And there are other teledentistry software out there. I'm not super familiar with a whole lot of them, mostly MouthWatch, and there's like one other one, but it doesn't matter really to me like which company you go with. I would just say go with one that's reputable. There are a lot of ones that are popping up, and they just started teledentistry right now because they've seen that, oh, teledentistry is the new thing, right? Everybody's trying to do it, so they've started their own company. But I really would be careful if they don't have good safeguards, if they're not protecting patient information, that is not okay. I worked for UT Health, and I was on a RFP to buy telehealth software for the entire health science center. And there are a lot of really good telemedicine softwares out there, but then there was also requests that we got from companies that really were just a random person saying, I have this teledentistry software, but they weren't, they really didn't protect patient information. So I would really be careful and do your research as to which company you choose to use, because I would hate for somebody to get in trouble because they weren't safe with patient information. And that's really all I have. I'm open to questions that just kind of give you a quick, short overview of teledentistry legislation, and open to discussion.
Well, thank you very much, Amber. That was very, very, very helpful. I have one question here. It says, once you initiate a consult with a patient, do they immediately become a patient of record? I mean, let's say you never met this patient before and you just talk to them for the first time over, you know, Teledent, for example?
Yeah. So if you're in a state that allows teledentistry, then yes, that makes them a patient of record. If you're not, then it just sometimes it depends. Some states say that just taking their medical history and having an interaction with them makes them a patient of record. Others say that you need to have at least a limited exam. I do have my email address up on the screen. If you want specifics on your state, what restrictions there are, what's allowed, what's not allowed, you can email me and I can provide you with a like a fact sheet on your state specifically guidelines, because that can tend to be a lot. There are a lot of different things. Some states allow just a variety of things that others may not.
Okay, great. You mentioned that this can be recorded live. I mean, you can record things, and so if I think in our type of practices, we communicate a lot with specialists, with ENTs, with sleep physicians. You're saying that we're able to record, let's say, our findings from a patient that we just saw probably in person that day with a specialist, and upload things like CBCT pictures or any supporting material that we have to make that point. So that's wonderful. So all your software can do those things, correct?
Yes.
Okay, great.
The MouthWatch, and I think most softwares you can. Typically, it's what you do. And prior to COVID-19, what most companies did wasn't direct to consumer. And now it's kind of turning that way. Now it's more direct to consumer, where you have the patient upload information. But before that, it was provider to provider, where you could upload radiographs, intraoral images, any documentation. I would really encourage everybody to go to the ADA website. If you're going to do teledentistry, they have a short sample of what a waiver for your patient would be, to let them know, you know, you're going to participate in a teledentistry or telehealth interaction, and that they understand that what they're getting themselves into, like the treatment that you're providing, because some states do specifically state that you have to tell them, and they have to consent to a telehealth consultation. So having those things and statements like that are really important.
Great. I think that would have a lot of not only clinical value for us, but also marketing value, since we want to get ourselves to be known. And those guys usually stay pretty busy, so having the capability of recording and sending something at the end of the day would be very beneficial for us.
Yeah.
So we do have quite a few questions.
Okay.
So if you don't.
Go ahead, Jordan.
All right, yes, sir. So first off, the question was, someone was asking how they should research their state dental board language to find out what the state policies are regarding teledentistry, and would the best way to be to email yourself?
Yep, you can email me, amberl@tomagwa.org, and I'll refer you. Teledent has specifically people that research legislation, and they have like fact sheets specifically on your state. So I would take that, read that. If you have questions, I would still go to your state dental board and ask them specifically, because I'll tell you that I think that I'm a teledentistry legislation expert, and yet once COVID hit, the Texas State Dental Board changed their mind on certain teledentistry things. Before, we were just saying, and they were saying that you just couldn't do an exam using teledentistry. And then now COVID has hit, they're saying that you cannot do any teledentistry in Texas, period. That means no consultations, no triaging. All you can do is talk to a patient on the phone. You can't do like a FaceTime interaction with them, even if you're not charging them. And that's just something that the State Dental Board decided that they were going to put out. So while I can provide you with like a general fact sheet on your state, you should still talk to your State Dental Board because they can change rules and guidelines as they see fit. And then they also have lawyers on their State Dental Board. It's really sometimes up to how that lawyer interprets it. And there might be changes in those lawyers. And so one lawyer might interpret it one way and a different lawyer interprets it a different way. But yep, you can email me and I can provide you with at least a general guidelines of what your state allows.
Perfect. And another question we have is basically they want to understand, so if you do a consultation with a patient, just to clarify, do you need to be licensed in both states if they are out of state? Or
yes, if this is your initial consult with the patient, yes, you do need to be licensed in both states.
Okay. Will Teledent provide medical coding as well as dental coding because some of their practices are limited to TMJ or facial pain and dental sleep medicine?
So the Teledent software doesn't do the coding for you. You would still do the coding the same way that you do coding. So with your EHR, the Teledent software doesn't do that. Teledent just collects the information, encrypts it, and saves it for you. It allows you to interact with patients, but it doesn't do any of the billing. If that's the question, yeah.
So also, how is the reimbursement aspect of it designed? Is it per minute or by the code?
It's by the code. It's per interaction. And some have limitations, like you can only do one per day, which is reasonable. Some have one limitation, they can do only one per week. It just depends on the policy, but it's based per code.
Another question would be, so if they've already had an initial consultation with someone from another state, what about if they have follow-up visits from that patient? As in, so, that makes sense?
Yeah, that makes sense. So if it's an initial patient contact, like visit for you, I would still say you'd be licensed in that state. Going back to the insurance code company, it's also important to note that you don't necessarily have to bill your patient through an insurance company. You could provide, if you're doing fee for service, that's okay too. And then charge them what you see fit and what your fees are. You don't have to rely on insurance companies.
Sorry.
But if it's an initial consult, yes, you should. Even if it's a second opinion consult, you need to be licensed in that state.
So what would you say the average cost is to have basic teledentistry equipment?
So teledentistry equipment is not like super expensive. Teledent, so as I said, they're giving 30 days for free. If you have intraoral cameras, you can just use intraoral cameras you already have. If you're connecting with a patient, they're just using their cell phone or their computer. Teledent charges $149 per month or $1788 for the year for 10 providers. So most telemedicine, telehealth companies will charge you per provider. And so Teledent just does $1788 for 10 providers for the year.
So that means you can have up to 10 providers in one office and they can all be under that umbrella, correct? Okay.
One office or different offices, but you're under that same plan.
By license, you mean 10 computers in your office that can be used by different people?
Well, it doesn't even have to be in your office. Like it's web interfaced, so you can do it from your phone.
Right.
So,
or my laptop at home, yeah.
Yeah, exactly. So I'm in Houston and you're in Dallas, then we could connect and still be on the same program. So if you have an ENT that you work with all the time, then they can have an account to log into and they're one of your licensed providers.
Okay.
And one of the last questions we have here is what medical codes are used for billing telehealth initial consultations and follow-up appointments? Do we use the usual office visit codes or is there additional codes specific to telehealth / virtual visits?
I don't know specifically telehealth codes. or medical codes.
I can tell you, I'm going to refer some of the people to a webinar that I just saw a couple of days ago by Dr. Glenn Clark. Dr. Glenn Clark is the director of the Orofacial Pain program and oral medicine program, which is also going to be a specialty as well. At the Herman Ostro School of Dentistry at USC. If you go to their website, they have a video right on their webpage in the very front that has a great webinar given by Dr. Clark that has some of the codes that they use. They use medical codes there in the 9,000s, you know, the codes that we use for consultations. I'm not great with codes. I'll leave that to my staff in my office. But they have the different codes available, and he mentioned some of those things on the webinar. It's a great resource, and I would encourage people to go ahead and go to their website and look at that webinar that he has. It's about half an hour, and it's very easy to listen to him. He has a lot of that information. Yeah, and those codes are I think the way he explained it, they go and how straightforward is the consultation. I think 99212, it would be a very straightforward consult. 99213, for example, would be a low-level consult. If it gets more complicated, it goes to a 99214. Those are things that usually my staff deals with in my office, so I'm not an expert at that. I'll leave that up to them.
Yeah. So that brings our presentation to a conclusion. Oh, one more question we got here. So there are actually it's more of a statement. So there are modifiers that need to be added to the code.
Correct.
So I just want to go ahead and thank everyone for jumping on, and most importantly, thank Mrs. Lovatos for the great presentation. Very, very informative, especially for all of us during this time. And Dr. Vice, do you have anything you want to?
Yes, I want to add one more thing. I want to thank everybody for attending today's webinar. This webinar has been recorded, and you can watch a repeat of it in our YouTube channel. Some of you guys don't use YouTube too much. Please go to the AACP YouTube channel and subscribe to our channel. We won't bother you with a whole lot of notices because we put occasionally some videos that will get you up to speed with all the webinars that we're posting and some of the other videos that we have from our academy. We're under new management, and they're starting to be very proactive, putting a lot of videos in our website. When you subscribe, also click on the bell because that will automatically send you a notice and let you know there's a new video. If you subscribe tomorrow, you probably get an announcement telling you about Amber's webinar today, so you can watch it at your own leisure. Okay. So please don't forget to do that, and thanks for attending the webinar today.